Okay, so we have a patient who has graciously allowed us to capture her during the treatment with TMS. She's had a right hemisphere stroke, right MCA territory stroke with left hemiparesis. This is a fantastic way to allow for more mobility. We're actually stimulating the unaffected hemisphere, in this case the left hemisphere, with an inhibitory protocol. And hundreds of clinical trials have shown significant improvement with respect to gaining motor ability and accelerating the rate of recovery in patients with hemiparesis, specifically actually with respect to upper motor extremity and hand movement. So this patient has tolerated the procedure so far really well. Can you lift your left arm up? So she has spastic hemiparesis, and she's actually increased her ability to lift the proximal arm. In addition to this, she's had Botox injections into the finger flexors. She's also seeing a physical therapist and occupational therapist, and she's a complete trooper with getting increased recovery. In addition to this, we're actually doing neurofeedback, which is training her brain to actually gain more activity from the healthy cells to recover from stroke. This type of treatment is almost FDA approved with respect to FDA clearance. This is, of course, FDA approved in terms of the technology, and the indication for post-recovery is almost there. She's already ahead of the game. Okay, very good. So these are exciting times for neurology and neuropsychiatry. Here at Neuro Spa Brain Rejuvenation, we've now ventured into treatment of stroke. Studies have shown significant improvement with respect to motor recovery in patients who undergo TMS, or transcranial magnetic stimulation treatment. This is fantastic because we can actually help patients recover faster with respect to their stroke and disabilities. And this can be done in a matter of days. We're talking 1, 2, 3 weeks. And this is fantastic. So in addition to patients who have depression, anxiety, autism, or athletes that are increasing their athletic performance and cognitive performance, we now have data that clearly shows significant benefit with the use of this device for treatment of stroke. So as many of you know, stroke is often due to a blood clot that causes a disruption of blood flow to a particular part of the brain. So in this case, this diagram shows the affected side actually having infarcted or dead necrotic tissue. Well, by actually stimulating the unaffected side, we stop the transcallosal dominance and therefore allow for the areas around the infarcted area to recover faster. So when you combine this with neurofeedback, where you actually see your brain activity on the screen, together with physical and occupational therapy, you have the best chance for the patient to recover. And we have a patient currently undergoing treatment with this protocol, and I'm very excited for seeing the results over the next 2 weeks. She's already showing increased mobility, and these are fantastic times in neurology.